Okay, the main thing after the procedure, you have extreme arterism, it's really crowded. It's good. So we are looking if the blood flow to testis is okay.
Oh, okay.
And it seems there is good blood flow. Look at the arteries.
Like coming in and coming out?
Yes. So then the next thing, how much residual veins we have inside. So show this wound. Okay, here is our scar tissue. Now I am looking this part and try to see. Okay, this is artery. You have a very good, powerful artery, and in this side, you remember we left a vein which we clipped in many parts because it was stuck to this artery. This artery would be injured if I try to take this vein out. I tried, I take it maybe 5 centimeters, but usually I want to take it all. Now I will see how much residual vein is inside. And now I am moving through testicle and I have to follow this artery. Sometimes without color resolution is better. This is spermatic cord, arteries, veins, and we take 2 very big veins, so there is nothing. I don't see these enlarged vessels that we see before the procedure. Okay, this is artery. So next to it, actually there must be a big vein, which is not present now. This is good. Just next to it.
So the red is the vein?
No.
No.
Oh, no, it's the...
No, artery may be seen red or blue.
Okay.
This
The
is
rest is
Doppler
the vein.
device.
Yeah.
If it is going up, red. If it is going down, blue.
Okay.
Look.
So yeah, the clips, they're gonna stay there
Look, the
forever.
same vessel seems blue and red, you see? And I can change from here the colors. Maybe red, maybe blue if I want. You see? I can change it.
Yes.
So it's going up, red, going down, blue. It's artery. So next to it, there was a big vein, which is not seen now because we clipped it maybe 8, 9 times. Okay.
Oh, you did put 8 clips?
Yes.
Wow.
Yes.
And this is gonna stay there
Yes.
forever.
They are titanium. They will give no harm. It's proven with many years
Perfect.
in cancer
So
surgeries.
all here.
Yeah, we
Perfect.
put many clips in cancer surgeries. It doesn't make problem. In the testis side, I don't use it because you will feel them with
And then also, if for any reason you get hit.
yeah. And it's like piercing. People do
Yeah,
put
yeah.
these to everywhere. So this is very nice. Although we couldn't take the big vein out, we clipped it, so we are not seeing it right now.
Okay.
And the other 2 branches, 2 very large branches, we take them out like 15 centimeters branches, and one of them you see in the picture, it is divided into many branches, like 4 or 5 branches. So all of them are taken out very nicely. When we come very close to testis, there may be some residual parts. Let me see. Move through the testis. This is a big artery, really. You had a big artery. Our microvascular Doppler device helped us, but your artery is so big that even you don't have this microvascular Doppler, there would be no problem in your case. And here I come very close to testicle. Really satisfied, yeah. This is vas deferens, sperm vessel. You know, there's a tiny little channel inside it. It is the sperm channel, vas deferens, ductus deferens. Sperm goes out from this.
How big is it?
It's 2.5 millimeters usually. Around 2 millimeters. Look, this one.
Okay.
Okay, so this is a good surgery, and the blood feeding to testis blood supply is good, no diminished. Okay, this is good. I will now check one more time your photographs in the operation. So you asked about the swelling, right? There is a swelling. It's like if you had a fist in your face, there will be swelling, and the operation is like that. This swelling usually stays there for 2 weeks, but the pain goes easier, faster. And look at your scar tissue now. We will change this dressing. This is a watertight dressing. You can have a shower. Did you have a shower with this?
Yeah, yeah.
Yeah, it's yeah. This is the scar tissue. Biraz uzak. Okay, this is not too big, like 2.5 centimeters. There are some ecchymosis, which there's some blood, little bleedings inside the skin tissue. These are no problem. So tell me, how did you find us? Why did you come from United States to Turkey for this procedure? What do you say?
Well, I found the YouTube channel and I liked the specific way the operation was done, like taking out not just litigating veins, but taking them out.
Yeah.
And I mean the process, I mean it wasn't too complicated.
Yeah.
I mean if you organize it good, it's doable, you know, even if you come from United States.
Yeah.
And so it made sense. United States is really more expensive and
Yes.
you
Do
know.
you have insurance in US?
No,
Okay.
not currently. So
And what's the price of this surgery in US?
it really depends where you go, but it can be anything between $8,000 to $12,000.
Yes. Yeah.
Depends.
Really, this I don't understand. It is not really needed. This much expensive. This is a simple procedure. Even we do in the one of the most luxurious hospitals in Turkey. And my uncle is a urology doctor in US. It's really not necessary to pay that amount. I don't believe
Yeah.
that.
Yeah.
I think everybody is having insurance in US, so they make the cost according to these insurance companies. And if you pay yourself, it's too expensive and not really not logical to have this money.
Yeah, but even with insurance, it would have been still more.
Really?
Yeah, because usually, and also every insurance is different. Sometimes they cover more, sometimes they cover just a little bit,
Yeah.
sometimes half.
Yeah.
So,
But your main issue was these, taking the veins out, right?
Yeah, it's too big. Too big.
Okay. And how long does it take for you to stay in Turkey? How many days did you come earlier before the procedure?
I mean, this whole time is gonna be 8 days in total.
8 days is enough?
No, 9. 9. Yeah, yeah. I mean, we decided to come a little bit earlier to visit
Yes.
Istanbul.
Yes.
It's a nice city. So we came in Sunday night.
Okay.
Monday we did the first visit to check with Doppler.
Yeah.
And you saw right away. You didn't even need Doppler.
So yes, we could do the procedure at Monday actually, if
Yeah.
you wanted. So
Yeah,
so
yeah.
Monday afternoon, if we do the operation, and Tuesday, Wednesday you can rest at the hotel, and Thursday we can do it
Yeah.
control, and
Yeah.
Thursday afternoon if there's a plane, or Friday will be safer.
Yeah.
So like 6 days will be enough actually for this, maybe 7.
Yeah,
Seven.
if you want to be more.
Yeah.
For us, we also wanted to see Istanbul, but
Yes.
we didn't want to walk a lot after surgery.
And
So-
after surgery, how was it after surgery?
It was
So
good.
now it is Monday. And
Yeah.
we had the surgery at Thursday. You are Friday, Saturday, Sunday. And this is 4th day after
Yeah.
surgery for you. And what is your recommendation for someone? How long they have to stay after the surgery?
I would say till the next visit to check that everything's good. So a couple, 3 days, something like
Yeah.
that, just to make sure. But I mean, after surgery, I mean, first day you feel it more, but
Yeah.
after second day you can still, like you can already start walking.
Yeah.
Not too much though. I think
Yes,
is you know, you don't want to stress.
Yeah. Sometimes, some people, not all of my patients are coming from US, and
Yeah.
many of the patients nowadays, there's economic crisis all over the world, so they don't want to spend too much money, and they want to stay here as short as possible. So I say them 6 days is a little too less,
Yeah.
but manageable. 6 days, but 7 days, 8 days is better.
Also, I can suggest that if you budget good,
Yeah.
Like for example, we stayed in a hostel
Yeah.
in Istanbul, and it's
Yeah.
like cheap.
Yes.
It's like 1/4 of the price of normal hotel, and the
Yeah.
experience was good too. Like,
Yeah. And
so
eating such things, how much they had to spare for hotel and this kind of.
in total,
Operation included?
No.
All price?
No, let's say all price, all operation and this.
Okay.
you can get a hostel for like $20 per night.
Yes.
20, 30.
And eating is also cheap, right?
Yeah.
Yes,
Yeah,
yes.
so it's
total, I would say, like flights included.
Yes.
5.000?
In operation too?
Yes.
Like $5,000.
$5,000.
5,000.
Everything included.
So we try to keep the operation like 2,000.
Yes.
2,000 euros actually, and it's a
Yeah.
little
Yes,
higher
yes,
than.
yes.
So $5,000, you say?
Yes,
In
for
total,
flights,
flights.
That's
everything.
including like him too.
Yes, that's
Not just-
that's not one person.
Oh,
that's two persons.
That's including
Yeah.
him too.
So
So,
yeah, cheap.
It's cheap. I mean, just to give an idea, like flight $600,
Yes.
staying hotel it can be anything between $100, maybe some less. If you go to a hostel, like $20
Per night.
per night. Food depends
On
where you
how
want to
much?
eat, but
If you want to go restaurant or not.
Turkish lira is inflated, so like you can eat a lot of food for like not too much. So yeah, so it's it
manageable.
makes sense.
Yeah, it's
Yeah,
manageable.
economically and.
And look to these vessels. Yeah, before the procedure, look, your vessels was like that. There, we measured it like 4.6, 5.4 millimeters. This is 5.4. This is 4.6. It's written here. So these were really too much, too big. And with Doppler, look at the reflux. And from external view, you showed me, look, this is really too much seen from outside.
Yeah.
Now there's a swelling, but it will go. These skin veins, we don't deal with them. The veins inside that we are treating.
Yeah.
So I don't want to make them mix. So in the procedure, we see the veins, and we, as I said, we don't ligate them. Just try to take them out. We take them out and look at here, very long segment. This is my assistant Ali, and yeah, very long. If it is staying inside after the procedure, it will take very long time.
Yeah.
70% of the cases it will disappear, but it may take 1 year, and this is really stressful. And many of my patients coming, they are recurrent cases. When it doesn't disappear, they come me for taking it out. But in our operation, this has gone. And this is the external vein. We have 3 kinds of vein: external, gubernacular, and internal veins. When we take the testis out, we can take gubernacular and external vein out easily. Then we move into, this is spermatic cord, this is inside, and we move inside. And look at this. Now the testis is inside, and this is the inner veins. We also take them out. We don't want to leave them behind. And yeah, really we take long segments from here too. It's better this way, and
Okay, in this way it
And-
is easier.
yeah, this way.
This way there's a long segment because it is not very close to artery. Look at this. Normally we would expect this way.
It's not difficult.
By itself. But in our technique, we don't want to leave it behind for self-disappearing.
This one here, it is next to artery. Look
Yeah.
at its shape. It's curved.
But the other vein, this vein was
Yeah, it's curved. It's next to artery. But this one, with a little work, we can take it out. Then the big one, for the big one, I put these titanium clips, not one to one side, many. And
Right.
okay, here I think we make a control with the Doppler.
To make sure it is now.
Yeah, it's
vein here. Doppler.
this device is really working nice.
Maybe it is also seen by microscope, but this device is safer.
So here, we take the two veins out. The big vein is still there, but 5 centimeters has gone. Artery is here, safe. Still, in the testicular part, I see some dilated veins. So I will put some clips on these two. The operation is normal, conventional way. It's finished. But we are looking for the residual branches. We don't want to leave them behind.
Anything, yeah.
And this part, I don't like them. It is ligated. It will disappear by itself. But I don't want to leave them like this. And now I will put, I'm sure I will put, I think I had a video.
Okay.
So we clips the residual part. Now there is no vein, these large veins. The artery is going to testicle, and you will ask please your question.
Oh yeah. So the vasal veins are the ones that are gonna be
Yes.
used to.
The new root is from the vasal veins.
Is there anything I can do like to support their health? Like
Yeah, actually, everybody is asking. You are taking our big veins out. Where our blood will go back to our body because you take them. These are harmful veins. These are not normal. So normally, if an artery is in this diameter, okay, these veins are in this diameter. This is too much.
Yeah.
So it's not necessary. So we excise them, and this artery brings the blood, and the blood goes back from vasal veins. Still now, to your question, we know nothing about it. How to make them easier, what to do, but sports exercise is sometimes extreme exercise, can be harmful. So at least for 3 months, stay calm. Don't do too much exercise. You will feel with your touching, feeling, don't push too much. It's really a risk factor doing too much exercise. So I want you to stay calm and let the body find its new route from the vasal veins. Other than that, I really don't know any special things about it.
Gotcha. Oh, that's perfect. That's good to know.
Yeah.
And yeah.
So this is not a problem. These veins, because I take them out, the others ligate it, and they are expecting for it to disappear. People think, hey, she's taking the vein out. Other than this, the other operation, conventional operation, this is different. No, this is not different.
No, it's the same concept.
Yes, we want this vein to disappear. I take it out in the operation, so it is finished now. If I do normal conventional operation to you, we will wait 3 months, 6 months, 1 year.
Yeah. So this is better to see even quicker results.
Yeah.
Gotcha. Yeah.
And the pain is manageable. You are happy, right?
Yeah. It's not. I mean, I can feel it, but it's not like.
Yeah.
You know, it was more painful before. Guaranteed.
Yes. And before, did you have pain also?
Yeah. So I always use straps because if I didn't have straps, it was impossible. But with straps, containing it was easier.
Yeah. You had a good special device for that.
Yeah. To just.
Without it, it was painful, right?
Yeah, impossible.
And all around the world, urology doctors gives 50% chance for pain to disappear. If you ask them, I have pain, will it go? They will say 50%. Actually, this is the real success rate of their procedure.
Oh, okay. Yeah, because if you have pain, it's because you have the vein. Gotcha.
So when we take it out, immediately, if someone is having pain, they say, oh, I have an operation pain, but the other pain has gone. Because the vein has gone.
Yeah, no, that's interesting. So I'm really satisfied. So thank you again.
Thank you.
In terms of, I mean, inshallah, no problem. I do so, right?
Yeah.
Like, if that happens again, I will have to, like, if hydrocele, basically I get like fluid in the testes, and sometimes it happens, not always.
Yeah, hydrocele.
Yeah.
It's really impossible in our procedure. We do it in microscope. I see the lymphatic channels. I spared them. It's impossible. But still, if there's, it happens usually maybe 6 months after.
Later.
Yeah. And it feels like a balloon. You can easily understand. And I will ask to make a sperm count after you had a good sperm count actually.
Yeah, I was surprised.
After 4 months, if you are not married, 6 months is better. 6 months. After 6 months, do a sperm count again, and if it's possible, do a Doppler again, Doppler ultrasonography, and send them to me.
Yeah.
For those who are trying to have a children, pregnancy, we are giving some medications, and we have some medications to improve the sperm quality. We also give them. We will give one of these to you also. Because it's also improving the recovery of the vessels, the tissues. They have supplements, vitamins, but really special for this issue. So we use such things. Nowadays I am using these. Tomorrow maybe I will change them, but we need some supplements like this. I know there are many supplements in your country too, but these are guaranteed for me, so I want my patients to use one of these after the procedure. Okay, you are happy with the procedure?
Yeah.
Yeah. Okay then. Nice to meet you.
Likewise.
Welcome again.
We need the picture?
Yeah, please.
Due, uno. Ok.
Bir defa daha çek.
Çektim 2 tane hocam. Evet. Çektim.
Ancora. Due.
Thank you for coming.
No, thank you. No, I'm glad
I'm glad to
for everything.
meet
Went
you.
well, went nice. So right now I'm finishing the antibiotics and the painkillers, and when it's done,
Then wait for 1 month, and after 1 month use our drugs for 3 months.
Okay.
So we will-
not right away. Wait a
Not
little bit.
now.
Okay.
After 1 month, we will now give you 3 bucks of these,
Okay.
and then you can use it after the procedure.
Perfect.
After 1 month.